Hey guys, it's Dr. Hub. Whether you're in medicine, from specialty to super specialty, allied sciences, or simply curious, this focus content it delivers the key points you need to know. Let's look at the myasthenia gravis and the drugs which are causing them. So this is nothing but an autoimmune disorder. So where the antibodies produced against the NM receptors. So antibodies are against the NM. In case you haven't subscribed, please do subscribe and grow daily. And this is of the NMJ. And what it does is it results in a decrease in number of NM receptors. Decrease in number of NM receptors. So the increase in incidence associated in the patients with, so increase in the incidence, this is associated with in case of patients with the thymoma. So next, thymomectomy, it can induce the remission in most of the cases. The signs and symptoms it includes are the marked muscle weakness, and this is in degrees at different times and easy fatigability. A degree at different times, and also it results in easy fatigability. Then comes the hydrophonium test. So the hydrophonium test, you have the hydrophonium. Hydrophonium is about 2 to 10 mg. So 2 to 10 mg of the hydrophonium is given slow. So it is given slow, and it is given IV. So it is given slow and IV, and this shows the dramatic improvement of the symptoms. So dramatic improvement of the symptoms, and this is in patients with the myasthenia gravis. This is in patients with DMG, and but it is not in case of not in the muscular dystrophies. So how is it demonstrated? Demonstration is of the circulating antibodies of the NM receptors. Demonstration of the circulating antibodies to the NM receptors. So how do you go ahead with the treatment? So treatment wise, there is the anticholinesterase. So anticholinesterase are effective in providing the symptomatic relief. So symptomatically relieving, you have the anticholinesterase. Then there is also the neostigmine, the pyridostigmine. They are very commonly used. The long-term use of overdose of anticholinesterase. So overdose of the anticholinesterase. So this leads to the cholinergic crisis. So cholinergic crisis. Next, that is the severe muscular weakness. So it results in severe muscular weakness, and also the neuromuscular paralysis can be seen. This will be due to the prolonged depolarization. So this is differentiated from the myasthenia crisis. So how is it differentiated? That is, as we discussed, the severe weakness due to the exacerbation, and this is by injecting a small dose of hydrophonium. So on IV administration, we give about 2 mg, and this is of the hydrophonium. And the patient shows improvement in the muscle power. So improvement of the muscle power. So in such cases, it is known as a myasthenia gravis crisis. So if the patient muscular weakness deteriorates. So in case of deterioration, it is known as a cholinergic crisis. Next is the ventricular. What is to be done is the ventricular should be kept ready before the injecting the hydrophonium. So the ventilator, it should be kept ready before injecting the hydrophonium, as it may aggravate the cholinergic crisis, which is dangerous. So it can lead to the cholinergic crisis as well. So this should be looked upon. Then moving on to the corticosteroids. The corticosteroids and other immunosuppressants like the azathioprine, and or the cyclophosphamide. So they are useful in terms of the induction and also the maintenance. This is of the remission. Next, moving on to the plasmapheresis. So plasmapheresis and immune therapy can be done. So they may be useful in case of the resistant cases. Now, other thing we need to know is important is the contraindications. So what drugs are contraindicated in terms of the myasthenia? So you don't administer the aminoglycosides. Then the antibiotics are totally no. Antibiotics, they are contraindicated in myasthenia. The D-tubocurarin is also contraindicated, the beta blockers. Then also the ethers, the phenytoin, and also the other neuromuscular blockers. They are all contraindicated. Thanks for watching. So in case you haven't subscribed, please do subscribe to learn and grow daily. And this is a special thank you note to all the subscribers of this channel. And we have a 30+ playlist subject wise, and it is in the description.